There's no restriction placed on them. They can also lead to hepatitis. And like I spoke about alcohol, excessive intake can also cause hepatitis. Now, in virus hepatitis, we have A, B, C, D, E, and etc. But among all of those, the one that has the danger is hepatitis A and hepatitis B, by extension C. Now, there's a benefit when it comes to someone who has hepatitis A. We say the cell-related. In other words, I can be positive today, and once I modify or I change my lifestyle, my liver can get healed again. So when you repeat my test data, it reads negative, which means I'm hepatitis free. Are we there? Yeah. While for the B and C, once you are diagnosed of either of them, for the rest of your life, you got a particular infection. So I hear people around and say, we got supplement you can take to get rid of hepatitis B, hepatitis C. Those are marketing strategies meant to get money. So if you are diagnosed with hepatitis B today, until God calls you, you have it in your blood. Are we there? Yeah. So, how do I know the means through which one can get hepatitis? There are a lot of ways you can get hepatitis. Number one, let's consider hepatitis A, for example. You can get it from eating food that is not contaminated with hepatitis A virus. I'm a cook. In the law, say cocoa, right? Cocoa is the one you can pour in the soup. Pepper, vita, cocoa there. But it's actually coke. So I'm a cook and I'm infected with hepatitis A. In the process of cooking, probably I had a cut and my blood leaked into the soup. People can eat that food. If the virus is active in that food and you took it to your system and made it to your blood, you will come out with hepatitis A. So if you contaminated food or even water. Now, another one is through contaminated feces. Feces, in our library, we see what? Poo, right? So we have, for example, you have the septic tank up and the well down. During rainy season, septic tank overfill, right? And start to flow into existing places where they got water. And probably people drinking small water. That can also lead to that person developing hepatitis A. So we say what? Contaminated food, contaminated fluids, right? And feces. Those are the means through which hepatitis A is generated or is being transferred from one person to another. Now, in the case of the B, which is the most dangerous one, it can be through a change of body fluids. And there is only among those who take in drug, especially injectable ones. Because if we have a 10 person, we have 171 needle. So as soon as I took my time, next to me, grab it right, and do theirs. So I will share a particular needle. If I got hepatitis B, right after I inject myself, I deposit hepatitis B virus into that needle. You will take it less. You are the one contracting that particular virus. Apart from needle, result, how many can share with something with cleaning needles? I call my needle for the result blade and then give it to someone next to me, right? If I have hepatitis B and I blade had a cut, probably the blood skin is on that blade, but you can't see it. Next people will use it. It's also a risk of developing hepatitis B. So this is why it's better you use one blade and press it. Don't say that my brother or my sister know. Like I tell my students, don't say because they want to teach me TNC. No. You only know if you are running a test and get results from the test that you ran. Now because if it appears to be healthy. Are we there? Another one is through body secretions. Body secretion, whether during sexual intercourse, during sporting activities, or even wet case. Those are means through which one can contract hepatitis B. Now, in the case of hepatitis C, it is related to sexual intercourse, or we need to modify it, unprotected sexual intercourse, wherein this person didn't use a condom and it just went on. And they will also have the use of drug, can also be another means of spreading hepatitis C. Now, in the case of the D, we say there is through infected blood. But in our setting, it's a rare condition. But the most common ones we have in Liberia are hepatitis A, B, and C. Are we there? So, both our cases, we look at the combined test, that the one we're going to be running today is a combined test. It pick up both B and C. So, how do I know I have hepatitis? Or how does one know another person has hepatitis? We call it signs and symptoms. What you can see on a person, that's the sign. What a person will tell you, that's the symptom. So number one, if I have hepatitis, one is my body color going to change. If you look at my palm, it's pink. When I have hepatitis, my palm is going to change to yellow color. We call it jaundice. My eyes, the wet part of my eyes is called the scleria. If you see before me looking at eyes, the wet part, right? But in the case of someone who has hepatitis, that wet part can change to what? To yellow, which is also jaundice. In some patients, they suffer from anemia. Their blood always running low. And we'll surprise in most cases, you will transfuse blood, you will get that patient blood today. After 1 or 2 days, the person blood will low again. Because this particular virus, it affects the liver. And the liver plays a major role in blood cell formation. So when it is under attack, the role that it's supposed to play, it becomes reduced. Now, in some cases, the late stage of hepatitis is where the patient develops called ascites. Ascites means plenty of water in a patient's stomach, or the stomach becomes big. They also develop what generalized edema. The whole body becomes swelling up. Hand, legs, face, everywhere becomes swelling up. Those are late stages. Now, the somebody spoke of liver failure. Liver failure is the end of hepatitis. So if a patient develops liver failure as a result of hepatitis, that person is on what we call terminal management. Even that person, their life has come to an end. So what we do as nurses, we just keep caring for you until we work for you. So at that time, in fact, the patient, they say, you have that feeling. And they will start with that older person will start to tell you about the time we were young, one of those things they did, and probably they see you moving the way that they were moving, and they will start to get you advanced. And at that, those are signs to tell that the patient is going to the grave. Death is around. And then somebody will say, oh, but just around the old man, I was lecturing him until I was young, but now today he's dead. It is because he was already aware of his death, and he didn't want you to end like him. So he gave you pieces of advice. So next, do we have treatment for hepatitis? There's a difference between management and treatment. Management is where you live on drug for the rest of your life. Treatment is where it will treat you and the infection goes away for good. So in this case, hepatitis has no treatment. Are we there? Hepatitis has no treatment. When you are diagnosed today, you will live with hepatitis for the rest of your life. But in developed countries, like Europe and the US, the only treatment they have of hepatitis is liver transplant. That word transplant means we will take another person's liver and then we'll take a liver that is already infected and replace it with that person's liver. And next what I will do is hemodialysis. Because no blood in circulation by the virus in the right. So we'll carry to a machine. We have two connections on your body. So one side is drilling the blood from you, passing through that machine to be filtered, while the other side will turn the blood has been filtered into your system. Some of you can pour palm water. And you can filter the palm water. After you beat the pipe for water, you can filter it, right? So only the bottle you got to use for. So that's what that machine does. It filters your blood. So that the transplant is done. But until welcome to Liberia, I don't want to say poor country. We don't even have what we call cardiologists, people who specialize in having liver diseases. So if you get hepatitis, they know that your own. Until God calls you, you have it. If you have money to travel, people liver transplant. And then somebody will say, where do they get a liver from? I know somebody question that. In the US, for example, if I got my grammar lesson, I sign a will. And I will clearly states in case I have an accident, right? And the data is fully aware that I cannot survive as a result of that accident. Any other functioning pass on me that is given by another patient later, that part should be extracted and donated to that patient free of charge. We understand it? So if you log in and somebody had an accident, probably the whole head got burst. They bring out damage, burst, they bring out damage, then that patient will die. Even though the house will still be working for a few minutes, but that patient will stay there. In that case, the drowsy, they will go like a sun. Your liver can be extracted and transplanted into another patient. So those are means. So nobody goes and say, oh, I can donate my liver because of this person. No. If you give me a liver, why you liver? Your liver is a chemical factor of your body. All the things that we eat, all the things that we put into our system that are dangerous for our health, there is a liver that can reduce that danger. So that's why if somebody has hepatitis, there are a lot of restrictions being placed on the food they eat and the medication they take. Because if you keep taking medication, like your liver is healthy, it causes more damage to the liver than even the hepatitis virus itself. So there are a lot of restrictions being placed on your intake of substances. Now, we have vaccine available that can be used to prevent or to minimize people coming down with hepatitis. They have the hepatitis vaccine. So if I took the vaccine, it means that I am immunized or my body becomes stronger against hepatitis. But again, there have been cases where people took the vaccine and still kill them with the infection. So not because I don't have the vaccine, so I don't care like no. They understand there are factors that affect the vaccine potency or the strength of the vaccine. That's why every year who are well with vaccinators. Every vaccine actually indicates something. We call it the vaccine viral monitor, VVF. Now, based on the color, it's going to tell you whether the vaccine is good, it is poorly, or it has spore. If it appears green means what they like, right? It means that the vaccine is good. Yellow means the vaccine coming to spore. And how many of you can have everything will go over to take vaccine? It's not possible. So for the treatment of hepatitis, we do diet restriction. We tell you what to eat and what not to eat. Are we there? And we also monitor you to see whether you are progressing or you are deteriorating. So that's our presentation on hepatitis. Maybe we can use 3 minutes to answer the question. Yes, Mr. Bakon.
All right, and so because you spoke of cells in the liver, right?
Yes.
Because cells can replicate themselves. So it may up to currently there's no signs that have detected cells being replicated for the liver, by the liver, or by any instrument.
Let understand this, right? There is not, in the case of an accident that happens to liver cell, probably due to chemical exposure, wherein those cells can regenerate or they can grow over. This is not the case. This is a case wherein you have a virus that is replicating, it making copy of itself. So, for example, if anyone had just one hepatitis virus, in less than 1 minute, that will not contain the millions of the virus. So the rate of replication is even more than the rate of the liver cell replicating. So it's not possible in the case of hepatitis. Because there is many production of the virus. And in fact, in some cases, like they have been proven a patient who dies as a result of hepatitis needs special care. Because at that time the virus is already looking for a new host. You get my point? That's why looking for a new host. So anybody, when you expose yourself to A, they enter into your system, forget it. You finish getting yours. Yes?
Yeah, in your explanation, I got a little bit confused when you talk about the hepatitis A, you talk about the treatment. Because in your previous explanation, you said that the A can be like, can dismiss based on I think the food or the treatment. But now in the treatment aspect, you said that there's no treatment for the hepatitis both A, B, C, and onward.
So there is a clarity. Hepatitis A is cell-limited. Cell-limited means that if I clean out hepatitis A, my body can fight it and get it out of my system without me taking any medication. But in the case of B, C, and D, no, that doesn't happen. So what we do for such a patient, we get management. Now the management is the restriction on diet, the restriction on medication, the restriction on social activities. Then you got hepatitis, no need to drink alcohol. What we do alcohol, one of the causes, right? So what we be drinking now will cause further damages to your liver. Even other food, I would say, we say food, we tell you don't eat it. Don't eat red meat. So there are a lot of restrictions being placed. It is only meant to sustain you until you have put data and you should go. But in terms of have treatment, for example, if I got gonorrhea and I want to take Cipro and get it out of my system, no, that's not the case of hepatitis. So, but if you are fortunate to get an A and your body immune system is strong to resist it, it gets off.
Yeah.
I will come to you, yeah, Rajos.
So, I want to talk a little bit about paracetamol getting involved in the
Okay, good. So, like I said, right, I'm not going to go in detail. I'm teaching in a medical school.
Yeah.
Paracetamol has a substance in there, a chemical substance that is very dangerous to your liver cell. So, once you keep exposing your liver to paracetamol, it will keep damaging your liver. But again, in most cases, we don't have the equipment that's supposed to run our blood drug tests. Like the developed world, for example, if I put you on paracetamol, they got to tell you wrong, and I tell to tell you, for example, if you took paracetamol this morning, we say 2 morning, 2 evening, right? From that morning to the next time you're supposed to take another paracetamol, how many percent of that drug your body use? Is it developed country? You can't find it in Nigeria. So what happens? For example, when I talk corrector, you go in out, you see somebody will take 1 shot of paracetamol. When they take 4 or 6 tablets, they will say they drink 1 crate of Starla because you can't get drunk. Yes. Once you take it, any of the painkillers, you go to the same, you alcohol, you can't get drunk. They will drink and you go work, no, you go home. You don't have it there. Alcohol needs to be broken down by your liver. The medication you told you to be broken down by your liver, so before you start fighting all the liver, who to save first. So at the end of the day, alcohol becomes free-flowing agent in your body, while the medication becomes free-flowing agent in your body, so you can get drunk. 2 of that, it goes from front of 1 chair, who is sitting in that chair because they look alright. So that's what happened. But at the end of the day, you put more weight on your liver. Because alcohol by itself can destroy your liver cell. Medication can destroy your liver cell, but you got the 2 in your system. so that they will become confused. So paracetamol, if you read on it, will tell you it's the number one medication that leads to liver damage. So this is why we have restriction, right? Look at the duration of treatment of paracetamol. How many days? 3 days. Look at antibiotics. Cipro, you go for like 7 days, 14 days, 28 days, and etc. Because the number you take those medication, the painkillers, you predispose your liver to danger. So that one benefit while the duration is shorter in treatment, 3 days maximum. While other treatment go for a month or more. Yes, Johnson, from the Kando, Mr. Bomuyo.
Alright, so it is check. If I have hepatitis, is it good for a person to announce to the judge that I have?
You said? What a question? Hello? Yes, Mr. Baum.
So if I have hepatitis here, is it good for an individual, anyone with such condition, to announce to the church that, oh, I am a hepatitis patient and I will need to be treated this way, or I will need some extra?
So this is the first thing. In our ethics, we have what we call confidentiality. Hello? It means keeping the patient result as a secret. Are we there? Now, except wherein that patient has agreed for that condition to be shared. That's one. Two, except wherein that patient condition is a public health emergency, you don't keep it as secret anymore. So that means public health is there. Public emergency. Are we there? So, for example, in the trial, I don't smell like COVID-19. And I keep it. When it comes to government attention, and the rule I was in the rule of A, I have committed crime. Because that's a public health emergency. But where in the case of hepatitis, no, you don't have the right to share about the results. Except where you actually wants it to be shared. Now that they probably have to sign a document, and that document will be used tomorrow. It actually has an issue against you. So we'll come to you to take Sam-Abel and then lastly
yeah. The important part that can be extracted from the person who is almost to die. Can it be kept for a long period of time? It will be transferred to another person?
It is based on, the hospitals that care on transplant, they are not our tier 1 country hospitals. They are advanced hospitals. In fact, they are places, even though organs can be kept and that life can be sustained for months or even up to a year. So they will put it somewhere special and will keep functioning until that transplant is done successfully. Yeah, so Chief.
Sorry for me. I want to say meaning like myself we can't tell people that who are having this thing that.
Yeah, if we should do it is good. When HIV business started in Nigeria, we have people who go in gathering like this and tell people say, I got HIV. I got diagnosed in 2000. I've been on medication since then up to now. Right? We had a training called Road to Health. What's it Road to Health? Yeah, Road to Health. And we will bring HIV positive people. And some people, when they stand before you, you don't even believe they got HIV.
And also, thank you, brother. You said in the third world in Liberia. For me, for us in Liberia, yes, will be good. Even in Shakara, only don't have it. You go because somebody will look at you. Now you're not saying, but my brother, they think I you. I think I get something for you for all that God level. But when you say you value yourself, that disease that will say you love him because they make and will tell me. Then you will start getting West one of the day.
Alright, that's good. So let's go to our next topic, please. No, let's go to our next topic back here. No, let's give a question. So our next topic is HIV. From then Amma will come and do malaria and then I push her with malaria tough. That will push her with. So HIV and AIDS. Hello. Those are two separate conditions. There's a difference between HIV and there's a difference between AIDS. Someone who has HIV appear after the end of us in the church now. But if somebody progresses to AIDS, even a walking child can look at that person and question their appearance. Hello? So when you get the word HIV, that abbreviation, it stands for human immunodeficiency virus. Are we there? It is another virus infection that attacks our immune system and compromise or stop the immune system from working in our interest. Are we there? Well, when you talk about AIDS, it's acquired immunodeficiency syndrome, and that's the end stage of the HIV infection. So, if you tell somebody that HIV and AIDS, if you that person appears to the AIDS time. In Liberia, we have two types of HIV infection. We have type 1 and type 2. Are we there? Who's how many types we have? Type 1 and type 2. Now, these two got similar signs and symptoms. They treat patients the same way, no difference. But the only difference is that in Liberia, most common type is in type 2. One type 1 is the one that comes from Europe or America. So those days, if you see someone that type 1 HIV, it means the person has a relationship overseas, or the man have come in contact with somebody from overseas. Unfortunately for Liberia, most of the medical who are available was only for the one we had present in Liberia. So then what happened to those who have a type that is common in the States? They have to buy that drug from overseas. Are we there? So, currently we say there is no cure for HIV. Somebody diagnosed of HIV today, on the other person die, they cannot be cured of HIV. In other words, that person cannot take any medicine to get HIV from their system. Once they have birth, HIV is present in their system. Now, what do we do for people infected with HIV? We do proper medical care, and we also help to manage their condition. So, is HIV only limited to Liberia? No. Let's look at the global statistics. In other words, around the world, how many persons are infected with HIV? So we're going to go step by step on your NO Liberia. Number 1, in the entire world as of 2019, we had 38 million people infected with HIV. So in my 2019, 38 million persons. So even if there are maybe 2% or even 0.75% of this figure every year from 2019 to 2024, immediately 38 million has increased maybe up to 45 to 50 million people infected with HIV. Are we there? So in Africa, as of 2018, we have a 5.9 million persons living with HIV in Africa. 2018. So check from 2018 up to current. It means that the number has increased from 5.9, which will be heading to somewhere around 8 to 9 billion persons across Africa. Now in Liberia, as of 2019, we have 47,000 persons infected with HIV in Liberia as of 2019. 47,000 persons. Yes. And we had the HIV hotspots in Liberia. It means that these are communities like that, a lot of HIV people living, or people living with HIV. A model communities, Ganta King number 1. As of 2019, Ganta was tapping. Next to Ganta was Bikena. Next to Bikena was Kakata, Zwerdu, and then Moroville. So those are the hotspots. Now, why the places are considered hotspot? Because you have more cases of HIV coming from there, and then 2, lifestyle of people in those places contributed towards that. I don't know how many of us have traveled across Liberia. But Ganta, no sleeping. Bikana, people can see some part of Bikana, but maybe around where they got diving where and other places where they got some crop around that place. People don't easily sleep. Kakata is another boarding spot, and then Zwerdu. So those places reported higher number of HIV cases out of the 47,000 persons living with HIV in Liberia. Now, to know if somebody has HIV, we say the signs and symptoms. They are based on system. I'm going to discuss it quick. 1, initially someone who is infected with HIV will complain of fever, headache, muscle and joint pain. Sometimes they will develop rashes on the skin that you were saying, crop. The body will come to the, they won't take my skin, will making, crop my skin plenty. So you get the tropical ointment or some local ointment and rub on the skin to get rid of them. At that point, apply it, it goes away. As soon as they stop, they come back. So they put that crop on them, and they have been taking treatment over and over. Once they are on treatment, there is a progress. When they stop treatment, there is a relapse. Your heart should go on HIV. Another is sodium lymph glands. When we were all small, they began so on your foot, and you feel knocked around here. When I saw guess what with the knock, it goes away. But in the case of HIV, that now will develop and be there. And at times we take antibiotics, it dislodges, it goes away. When you stop it, you come back. So, in the case of the late stage, because when these things are happening initially, we can say, oh, maybe I'm feeling like I got malaria or I got typhoid, right? Your hair, your skin hurts, you're going to run on HIV. But in the late stage, fever becomes persistent. It means the fever cannot go away. The patient who used to walk maybe the 4 years to carry blood time, they are unable not to walk and carry blood straight, fatigue, or tiredness, skin. There will also be lymph nodes that will be swelling up on the arm, on the neck, and other parts of the body. But there's oh, now I just come on my skin. There will also be diarrhea. This person's stomach starts to run. And in that case, that person will take all of the anti-diarrhea medications. They can stop. You know why I will not stop? Because what causes that diarrhea is not being treated. So when I have had diarrhea, I took in toxicity, I took in flagyl, I took in the one, I took in that one, but still my stomach still running. Go do your HIV test. Are we there? Another complaint is weight loss. Because in the list of HIV there is emaciation. The body gets dry. So as the person gets dry in the weight, the people reduction in weight. But that person cannot tell you why their weight is getting reduced. We've got an unexplained weight loss. I'm eating good food, I'm working, but my weight keeps dropping. And then there is also oral yeast. The one called trash. I can feel the children. It can be in a mouth. But being made is in trash in my mouth. Your heart will go on HIV. Are we there? Then, in some people they develop what shingles or what herpes zoster. In our latest setting, we say If the romantic account one side of the body, and we say if it crosses to the other side, what will that person? It will die, right? You want to know what I say there? They call it belt. Fine. That's a common belt. So someone who has HIV can also develop belt. And then pneumonia. The lungs can get infected in HIV. So for the diagnosis of HIV, we have tests that we can run. We have what we call a rapid test, but I want to get to your blood pouring on the machine. In 15 minutes, it reads positive or negative. And then we'll have other advanced tests like the CD4 cell count, and etc. So we got tests that we can do to know if we got HIV or not. Are we there? Now, how does one acquire HIV? Number one, through unprotected sexual intercourse again. That's one. I keep telling you, somebody apparently on reason that they are healthy. Is it clear? Don't say, oh, but Abel is dressed. He's undressed and he knows about things. He appears healthy, so he's healthy. That's not true. Somebody else again, they are poor people, are rich people. Are we there? So make progress. So another one is share of contaminated medical devices or materials such as needles, syringes, blade, and etc. I'm not 2019 when I just started. No, not about 2008 when I started the nursing school. Our parents had one clinic. Some of them know about the clinic. They now had 2 TV for all your patients. Will you want needle? Get injection. I see needle, get another injection. One syringe. So when you ask to be supervisor for nursing, I accept that. Imagine as a nurse, supervisor, other people are making in the system. So when I then went, all the team took me to the incinerator. They look and burn medical equipment, medical or waste. I burn up. I went in the warehouse, I told you once. So I think when you come and say, when I'm there, when you come and get injection at this kind of needle syringe. And then you say, oh, you see the opening and the opening. I said, what do you mean by this? Should we be using one needle on 2, 3 patients you will risk associated with that? I told you it is better you charge and the person pay, they remain healthy. Then you honor charge and the person carry a lot of illnesses. And that's how you ask me to go rest. You know, when you come in, I didn't call. After 2 or 3 weeks, you call me back. And then I was worried to follow instruction or not. I don't say for me my ethics can buy you that. And furthermore, what you pay me, I appreciate about the first time my kerosene matches mosquito call. The local city and somebody, I'm going to pay me phone and I live per month. I live over needs to your clinic. So later on, he said, okay, what you say is true. So what I'm saying in short, all the things when they are contaminated, right? I use maybe the syringe or the needle, and I'm going to use it on another person. If that person's blood has the HIV virus, and I use it on another person, I'm going to get it out. But at that time, that new person doesn't know they have acquired HIV because there are no sign and symptom. And that's why I tell people, when you come to my place, when I'm preparing medication, I'll prepare right before you. I will open syringe before you. I will be medication before you. When I'm done, I'm going to discard it. But many are trying to go to places and people say, look at prayer medicine, you're not there, you don't know what they're using on you. So I tell you about that, but I want to be present to prepare my medication. And I don't use one syringe fast. No. If I use one syringe, I get medication and choke away, let's come up with new one. All the things can be in your bill. But I don't know. Prepare medicine, I can't hold it, you go. You don't know any syringe with another person. Or that needle. So always ask for a medicine to be prepared before you. is another means that we want to reduce the transmission of HIV. So also infected blood and blood products. Or you say, oh, your son blood low, can't get blood. So here, who was they got to screen you? They got to do HIV, they do malaria, and they do hepatitis B. Those are three tests can be done before getting blood from a donor. In some entities, they can do other tests, but those are the most common ones in Nigeria: HIV, malaria, and hepatitis B. Because if you took blood that has HIV virus and you give it to another person, it means you are infested that person with millions of the HIV virus. Some of us, for example, you had a burn, and maybe they need to take tissue from somewhere else and put it on that burn. And if that tissue is infected and it's been placed on you, it can also be exposed to HIV. Somebody had a cut, and you use your bare hand to press on that cut, right? So now with that cut near our palm, don't you know? Have you experienced it before? So then you get caught in your palm, you don't know. You want to know maybe if you put a hand alcohol or maybe pepper, and it starts to burn. So if there's a cut in your hand, you keep one of another person's blood that is infected with HIV. You come out with HIV infection. And lastly is during pregnancy and delivery. Pregnancy, delivery, and breastfeeding. So then the question becomes, is it possible for a pregnant woman to give birth to a child who is HIV negative? Yes. We have had other cases. A woman can be HIV positive and give birth to a child who is HIV negative. But that is based on the clinician and her own efforts. But once she's pregnant with her own setting, sensitive, non-sensitive delivery every day. And no setting. Setting can be used to suppress the HIV virus. So every day you take non-sensitive delivery until you give birth. Without other medication, you also can help to suppress the virus so that child doesn't get HIV virus from the mother. Now you can even do all of them as we deliver. That delivery was done behind the house. We say the woman had to do delivery. Because that woman did a delivery, but there was an exchange of blood between the child and you. Or probably there was a cut on that child and your blood enters into that cut. That child can get the HIV. So that's why we encourage people to give birth at health facilities. Because we have skilled birth attendants, people who are trained to deliver women. I'm not saying the woman is not trained, they are trained, right? But the care is not very big given. And then during breastfeeding, if a mother has HIV and she's breastfeeding, when there's a sore on her breast around the nipple, she is discouraged from breastfeeding that child. But when there's a sore, what it means, there will be fluid from that sore that will make to the breast, right? And when that child sucks it, the child can have HIV. So those are means through which HIV is spread. So what do we do for the public to stop the spread of HIV? Number one, we need to do what we call educate community dwellers on the spread of disease or the disease. That's what I'm doing now. Two, we also need to encourage people to change their sexual behavior and practice. Don't I don't like condom. Are we there? If you have multiple sexual relationship, reduce it to one. If we do what we call, like for example, I'm Abel, right? I got two relationships. Let's assume each of those two guys are one or two. And each of the other two guys are one or two. What happened to the number? So if you that for me, I'm going to put different exposure indirectly. Because my one got two. And each of the two got two. And I 4 plus my 2 got 6. So you got 6 persons to be exposed to. So if each of those 6 also got 2 each, if you go to 12, 18, 36, 72, and it keeps going on. Are we there? So we need to reduce it. Another one is we should encourage people to do their tests. Because you don't do your test, you will never know you have the condition. Until your test is done, and then you know where you stand. And then we also need to educate community to stop the stigmatization of those infected with HIV. I remember those days at the clinic, when we were in Ghana Hospital 2011, they had the HIV clinic separate. So imagine, Ben, myself, we are bullied at the community level. We went to the hospital for treatment, and I'm HIV positive. And Ben knows that anyone who goes into that clinic, they believe we have HIV medicine, right? So when Ben go to where other people are going, and I'm going to where only my mom going or a few person going. So you don't come out of the Ben, you must be with me. Those that want to say you got HIV, forget it. Even if you buy I say, don't bring out your signal here. So people start the same, they say it was bad. So everyone should go through the same means. The only difference is, I'm getting my drug, or Ben getting the one. It is up to me to tell Ben which drug I got and for what condition. It's also up to Ben, right? So with that, there have been reduction in the stigma associated with HIV. Are we there? And we also need to help people with HIV. It's good. Because some people are being neglected. Once family here, got HIV, forget it. You will go spend that to how much children get it or you myself. So we will help the people. So there are other conditions HIV can result to. It can lead to cancer, it can lead to teenage development, it can lead to damage to your liver, it can lead to damage to the kidney, also damage to the brain. Those are all complications. Now for the treatment of medications available in Liberia, and the good news is HIV medications are free in Liberia. Father, you're not paying. What you need to do is do your test, know your status, and then commit yourself to treatment. Finish. Are we there? Yeah. So at the end there, level to the last slide. Go on. Go on. Go. We say NCNS, no condom, no sex. And that can protect you from acquiring a lot of infections in addition to HIV. So no condom, no sex. We are not encouraging people, right? But I'm just saying that we for the health worker, that's what we believe in. So I think we'll come to an end. And we need a question on HIV. Yeah, 3 questions.
I have a question for clarity.
Okay.
Can HIV be spread through blood or by sweat or by anything? Or by spit?
I'm not understanding your question.
It can only be spread through blood because it's by sweat or spit.
Now, there is the issue. In the case of spit, except where if there's a cut in our person's mouth, and our spit is being contaminated with blood. Are we there? But also now, even in your spit, I will call it salivary amylase, which is an enzyme. HIV cannot survive the pressure of it. But so there's a cut, for example, I got HIV, I got a cut in my mouth. And then you too, you don't get HIV, but you got a cut in your mouth, and with kids, right? So that a change of fluid. But the HIV is not going to do a new entry into your body. It transfers to that body enter your system. In the case of the tears, they have been studied done where they say the tears contain HIV virus, but not at a level that can cause an infection. So there have been no proven case where the tears lead to HIV infection.
So that means that HIV can be transmitted through blood.
Contaminated blood and body tissues. Not just blood but contaminated. Because why not? Why not get HIV virus? How does one get it from this liver? Yes?
Yes, I already say pneumonia also is from HIV.
Yes.
So if you are diagnosed of pneumonia, you have HIV.
No. Pneumonia is a complication of HIV. It's another disease condition that develops as a result of HIV infection. There are the tissue of blood between the heart and the lungs. Where your blood goes for oxygen in the lungs and return back to the system of circulation, right? So if the HIV travels into the lungs, you've got pneumonia there. And everyone here will do BCG, that vaccine. So if you get HIV also, suppress the immune system, the vaccine you took to protect your system can also turn to an infection in you. Yes, Johnson?
Alright, studies have also proven that mosquitoes are the leading cause of malaria, right?
But it's for the HIV.
Okay, so with that. So the mosquito has to bite an individual, right? And there is a transfer of blood in that vein. So can that also lead to HIV because mosquito is suffering?
There have been no study to prove that mosquito is a vector of HIV transmission road. Yes, last question. Yeah, other thing is, yeah.
Yeah. HIV is caused by which virus and who is most at risk of HIV?
Everyone is at risk. It's caused by the human immunodeficiency virus. Is it understood? Everyone. The very first thing I don't want to say, you know, in some literature you take at risk, at people with multiple sexual partners, drug abuser, and etc. Right? But at this level, I just want to understand that everyone is at risk of getting HIV.
Operator, thank you. On our question, and the reason why we were bringing it here, it was I went for this leadership training. There was this statistics during Nigeria a couple of years ago. More church people have more HIV and these kind of terminal diseases as compared to virus or whatever compared to prostitute. The reason is because they are informed, they are educated, they protect themselves. But church, so again, because you're talking about race, because we feel that also are in church people are so ignorant and careless, we can leave everything. So when you are ignorant about anything, in fact, you are more at risk than talking about somebody who will have 10, 15 sexual partners, which is wrong. But because they know everything about it. But we the church people, we didn't care all that. In fact, there are people who are saying, most of them, especially church people, they will always say, in fact, I think it's not true, I don't believe this. And I think even somebody can do anything and kill somebody. You will be at risk. Ignorance alone, that you need to you get information, you make decisions. So I think the person who is ignorant is the worst. I think the most person will be at risk. Whether male or female, pastor or bishop, lawyer or taxi driver. When you are ignorant, you stand the most risk of getting it.
Thank you. So last question, brother back there.
I want to know because my son's instructor told me this, but really I want to know what was the cause of rape and which animal that brought us sickness, which is HIV. Because my instructor told me,
hello,
research on that.
Hello.
Yeah.
I keep telling you, I'm not going to teach them. I'm teaching them medical school. I'm not going to tell you the Japanese can get HIV. I'm not going to tell you the monkey can get HIV, right? Those animals can also get it. Are we there? I'm not going to go into the historicity of HIV. There are key things I need to teach. One is HIV, signs and symptoms, and if treatment available or not. So I think we're not out of time. Yeah, last question.
Please, I beg you. You got a lot of things we got to do the test. You got other questions? You are me personally. We set an activity, let's be frank too. You don't come by anything.
Almost 11.
We make it available. We will have Bible study time frame because some really activity for this thing. So yeah, you take all the time, go and do the session, you got to do the next lecture.
Yes, so I'm going to come quickly to do time for.
So, Brother, I'm sure by next Sunday we can have a little box where we can have our condom store. Or anybody want it? put it in the Bible somewhere.
So, like, you know what we're saying, it's funny but it's serious. Like when we were at JFK practicing, what the nurses would do, they had a condom there, they would put a condom there. Because they know when they expose it, you'll be ashamed to take it. So when we go home, they will whisper in our ear, if the Bible will tell you. So people will be like ashamed of it, but it's good. Yeah, one of them will be ashamed of I told you, you got my name and So, I will be talking to you on typhoid. I'm a clinical student, so I will be speaking to you based on my clinical knowledge. I'm now a teacher.
Alright, so we just want to do small icebreaker. So you can just stand up small, move your body a bit. Stand up a bit. Alright, so do as I do. Just do it. Do as I do. Do as I do.
Just do it.
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 Very good. So you can have a seat.
So, we have heard of typhoid. So, how many persons here can tell me a bit about typhoid? What is heard about typhoid or what you know about typhoid? Anyone can tell me a bit of knowledge about typhoid, what you know about typhoid fever, what you have heard about it? Yes.
What I've noticed about typhoid, if your food is open and blood is moving around, when you eat your food, and you start your bowel, you know that food is simply from there. Then you start eating up to
Okay, any other person?
Yes. Typhoid is caused by a bacteria, and a bacteria from around the food. The name of that bacteria is Salmonella typhi.
What is it? Salmonella typhi. Okay, thank you, Chris. Any other person? Okay. Thank you. All of your answers are correct. So, when we hear of typhoid fever, it's the same known as typhoid. So don't get confused if you hear of typhoid fever, it's the same as typhoid. So I will be giving you the definition of typhoid. Typhoid fever is a life-threatening infection caused by bacterial called Salmonella typhi, the one you said. So the typhoid can be caused by the bacterial called Salmonella typhi. It's a bacterial that when you get in contact with it, you get typhoid. It is usually spread through contaminated food or water. Once the bacteria are injected, they multiply and spread into the bloodstream. So when you come in contact with this bacteria, Salmonella typhi, when it is injected into your system, it spread into your bloodstream. So that why people will usually say typhoid and how to be treated, when you follow the referral procedure, because when you come in contact with it, it spreads directly into your bloodstream. And when you're treating it, you have to treat it terribly. Not just take simple tablet and then you go with it. Because it goes into the bloodstream. easily spread in community that lack access to safe drinking water and adequate sanitation. In your community, like I was setting in Liberia, now what people most often come down with time for, because it is widely spread in a community that lack safe drinking water and proper sanitation. People don't know how to keep their diet. It affects our drinking water. And then we live with the roaches, the rats all around us because of the dirt we keep beside our house. So to avoid, you have to keep your community clean and healthy. Some of that type live in human. A person with fever, with typhoid fever, carry the bacteria in their bloodstream and their intestinal tract. If you have typhoid, you carry this bacteria in your bloodstream and in your intestinal tract. So that while we have to be careful with the places we eat, we have to be careful of how we keep our diet, how we take care of our cooking utensils.
Amen. Amen. It's good to respect people. Anything we do in life that see, you want people to respect you. People are out there, they're not going in bad, but we get when they say that, and they respecting those who give that time to come and teach us. You're less, if you're tired with the sellers, you just go home. So get up and go out, you go to the bathroom, you go stretch, you don't want to sleep, you're tired or something, but to sit and having conversation when people are here, and you expect them to do the same for you when you stand there, you want people to listen to you. So if you can't come inside, you can go home. And we just close there, we spend money to buy all these things that will come into the test. I don't know why. We can't appreciate, the little things we can't just appreciate. People take their time to come and to stand before people and talk, it's not that easy. That's why Jesus was talking. He said, so what I will do now? I go to the ghetto, you say the men are prostitute. I eat with a lot of people, you say I greet it. I do that. So how you want to do that God with it now? But you're not going to do that one in that church. We can't even do it. I said the poor church, we can't do it. I said the poor church. Then when you bring your own, nothing, I don't know. You are walking out of the 7-2 by 9 like the gap where you back for your ugly.
So now who are they talking there? You're for the 40.
No, let somebody go there. They're not supposed to come here like we in democracy, right? You're not supposed to serve God. You're not supposed to come to the church. Get good. And why my place that I do that? I said they play that echo. When you're talking a big noise. Why you're so interested in your home, you're going to do it. Only one day we got in church. So when you're home, you're not there phone and call your friend, how you doing? But when you're going to church, you want to do all the talking, all the JJ pulling, all the gossip. You rather the gossip, don't come to church and beg you. We want to be here. You see, that's really big friend. I say this with love for everybody. I said, anybody go to them, and I can't even my country, the other side. Anything you want to do, you want to be successful, and follow successful people. The day I left Zion to go do God business, despite my limitation, I told God if they did not get no result inside a farm and way to do different things. To be inside and do the single way. Thank God since we started, we might not be where we are, but we're not where we used to be, right? So every time God opened our eyes to see, when I've been talking, I say, I see what that our million succeeding. They think we're doing like bread, they're not church, they're not even gospel, they're not Christianity. I see why they're succeeding. They think that work, that discipline. Guess what happened? The man left from here that week. The week he left from here. And I've been following him. The man left from here, then he went the following week, Friday morning. The man is having morning prayer service. For straight 4 hours. Straight 4 hours. All the leaders, so money they did. 4 hours and we laugh and we say, can you imagine? Then she said, so the people behind me, I said, yeah, the people who were here 1 month before he came, they had a crusade. And before he came here, they were in Singapore. From there, they went to Mauritius. They went, they went to Angola. From Angola, they came here. I think next month, so they will be in Sierra Leone. But when he left from here, they went for another service. That one, I got one of his services, 4 hours, they want standing here talking. That prayer, they will do prayer, they do music, they do different things. Then I tell you, I see why they make 6,000 churches around the world. I see why he got more than, 10,000 people sitting in one place. I see why he placed the Kodesh. I think he got more than, how many buildings is a city? But we gave God one Sunday, the night we all day, one Sunday, we come here about 10:30, we rush you to go home. Then we want the church to grow. And not just joyous family, it's all over like bro, we are dead lazy. Business people will leave 5 o'clock, they go to their offices, they leave at midnight and they're making millions of dollars. Be not deceived, God is not more. The time you put into any investment and the result you get God 1 hour, you get all your extra time, you get extra time blessing. You give God. So all the things we're trying to teach you, beloved, and to teach you quality. Have we made errors and mistakes in life? But we teach you so you can make those errors, so you can excel, so you can do better. We want your Christianity to be better. That's why we teach about our experiences. We want you to be an excellent in everything you do, and not just your church. You're going to work, put time to your work. If that business you're doing, put time, be disciplined. If you say that they keep putting food on my table, when you go there, don't put your market and you go sit down with your friend. Then when people buy, they say, who's selling here? Nobody there to buy by you. So if we come to God, we say we keep the gate next time, let's sit down here. Business people can go for conferences, they sit down 3-4 hours. They're not shaking, they're not putting food on. But we can't hear food still ringing. I want to really know that God will claim to come to. Beloved, we can make more out of God. Because he's a God who, when he says today, end, nobody can cheat him. And all the wonderful things they're teaching us, doctor can give you up. It's in my book, when God said today you'll be you nothing. When doctor gave me up, I want to be paralyzed or dead. Paralyzed for the rest of my life. Some of you connected to all, you know the story. So you can get HIV, you can get hepatitis. It ain't got no cure, but it ain't got no treatment, but God can cure it. And some of you said, yeah, you don't even know your status. You don't even know what they're thinking for you. Doctor can give you up, God can say, change the story around. They might disrespect me, disrespect water, disrespect joy, something. But it has some respect to God. Because you can leave from here today. Just by leaving from here, you say today that the last day you step in that church. They're done. No matter what kind of prayer, we'll pray here. So Paul said, is in him we live, we move, we have our being. When we come to church, let's come with purpose and attachment, discipline. Then notice you people teaching you leave for your problem, you can go and help other people. You don't have to be a medical professional. They took their time. Let that be respect and talking to them. Let listen to them. To why you want to stay here or stay somewhere else and expect people to listen to you. We love you, but we don't like discipline, especially in the house of God. Especially when we say we want the church people to be an example in the world. This is disloyalty. Your church agreed to do something, you're not part of it, you're part of the thing, you're not really part of it. You are the enemy within. Yeah, those who are proud, those who are ignorant, are the type of people that if you just know the thing you do what it is, you walk here among your blessing. They say the soul, when the soul sees some fall on the wayside, some on one tongue, some on one rocky ground. That's how we come to church, we get the word of God, we're not blessed. We in the church, our heart not getting here. And other people are getting blessing, you wonder how to make it, how to get in through. God bless you.
Thank you, then. Okay, so I can see people are already exhausted, so I will be telling you shortly on the symptoms and mostly how people get typhoid, the cause, how people get it. People wonder, like, we're giving care to a patient, and then when we give her a result, we told her that she had typhoid. the way she feel miserable within her body, she was like, how people really get it in? So they are all in our environment. We can only control them when we have knowledge on it. So, for you to know that we come in contact with typhoid through contaminated food, water, poo or pee. For example, someone use the toilet who has this infection, and then you want to use the bathroom. You use the bathroom. The person used the same tissue, like how we keep the tissue in the bathroom. The person use the tissue, they use their hands to hold the tissue, and then use that same hands to clean. So you went in the bathroom to use the bathroom, you use the same tissue and roll it with your hands, and then you come out. So you got a food to eat. Firstly, when you leave from the bathroom, what you was to do, wash your hands thoroughly, not rinse your hands. There are difference between washing hands and rinsing hands. Wash your hands thoroughly before touching anything that you use to go into your system, like water, food, touching your drinking cups. You have to wash your hands. Because we live in an environment where we cannot control these things because they are with us. We don't know who we interact with. So you have to be careful with that. Secondly, some of the causes that are listed here. What can cause typhoid? What can cause typhoid, like I earlier said, using the toilet contaminated, and then eating seafood. Eating seafood like the fish, the crab, those things that we catch from the sea. You have to prepare them good. Wash them. Make sure it boiled, prepare it well before eating it. We overlook these things. But you will say, oh, I don't go to the sea to catch fish, but how about the restaurant where you eat? The pork shower you eat. You don't know where they get those things from. So it is needed. Eating raw vegetable. It is good to eat raw vegetable, but before you eat them, wash them terribly. Because the fruit we get from the market, we don't know where those people get it. We don't know how it's being fertilized. We don't know what are those things they use on it. So when you get fruit from the market, raw vegetable, before eating them, wash them. Don't rinse it in the water or wash it. Wash it before eating it to stay healthy. Because we can't avoid them. They are with us, but we can prevent ourselves from getting them. You will prevent yourself when you know the preventive measure, you know what to do, and then you are aware of how those things, how you come in contact with it, then you will be able to prevent yourself from it. So the signs and symptoms of typhoid fever. Fever that stay low and increase throughout the body, especially reading as high 104 degrees Fahrenheit, 40 degrees Celsius. Fever will start low and then later it just increase all of a sudden, chilling in the body. Those are the symptoms of typhoid. And they will have headache. You chilling at the same time, the headache just pounding on you. So when you start feeling like this, and then you know that maybe I got in contact with some contaminated things somewhere, then you check where you've been, where you ate, who you interact with. And then you have weakness and fatigue. You feel so weak when you have this thing. You will feel weak in your body to the extent you will feel miserable. So when you start feeling like this, and then you know. We have stomach pain. You feel, somebody will ask if you feel all the symptoms together. Yes, in some people's cases, they will feel all the symptoms together, but it's not possible that you feel all the symptoms together to have type 4. It's not possible. Maybe you come down with fever, just increasing fever on the body, and then you chilling, pain all in your joint, then you know. We have diarrhea, and then in the late stage you will feel rashes on the skin when you overload it. You feel rashes all over your body, on the skin. You feel rashes. So I got some photos here, but you'll not be able to see it because my phone is not. How typhoid to you when you have it? You lost appetite. You lost appetite. You're able to eat your own food. And then the night sweating and it's cold. You're sweating at the same time. You're feeling cold. So if you see yourself with those symptoms, then you know that you have type 4. So someone will say that if I have type 4, if I'm feeling all the symptoms, it is possible that I do my test. Yes, it is possible that you do your test. Like we were earlier talking about over-the-counter drugs, they will not give you the exact prescriptions. Now what people will say, if you have type 4, it's hard to go. It's not a type 4 hard to go, but because you use the over-the-counter drugs, you buy your drugs over the counter, you're not even sure if it is the rightful drugs the person giving you. You just take it, and then all you feel like they're giving you medicine for type 4. And then people mistake type 4, and they will often say that when you have type 4, you have to treat malaria. It's possible that you can have type 4 and don't have malaria. And it's possible that you can have malaria and don't have type 4. So that when you feel those symptoms, you have to do your test. Like the already said that this bacteria live for human and then enter your bloodstream. Sometimes you go to the facility, they will do your test, the rapid test, they will do it and they will say that it is negative. But you feel the symptoms. So go to a bigger facility where they will use your blood to do the test. When they do your blood, definitely you will find out that you have type 4 within your blood. And when the test has been proven that you have type 4, then you can start with your treatment. I see people just taking self-dressing and leaving Cipro out. You have to, it's important. And then they will just give you start dose and then continue with the continual dose. Sometimes you have to hit it hard because it's in your blood. So, any other questions?
Yeah.
You're running again. You're not a teacher, right? A clinical student is a student. So she enters anything
Then you can ask your questions and answer it based on clinical knowledge. Yes. So you the first degree.
Okay, alright, thank you so much. My question is, you said the blood can reach in the bloodstream. So,
yes.
So what if my blood is low, I went to a medical center for treatment, and then it was, let's say, increase one level of blood transfusion.
You need blood transfusion?
Yeah.
Okay.
Transform the blood. And then they transform the blood. And that particular blood is contaminated with that particular bacteria. Yeah. So, can I get it?
Yes, like what earlier says, before any facility gave you blood, they will do the test before giving you blood. They will do your HIV, your hepatitis, and then your malaria. If you have it, they will not transfer your blood to any other patient to avoid that person coming in contact with disease or infection. So to answer your question, if you go to this facility in Demi, your blood low, you need blood transfusion. To put you on the safe side, they will not just grab anybody from anywhere and give that blood to you. There will be a proper checkup before giving that blood to you. And I'm sure that based on ethics, the nurse will not find out that person has some level of malaria and they transfer that blood to you. It's not possible.
According to the statement, you said that.
Yes, I said this parasite live within the bloodstream. Yeah? Now what before they give, then you asking if when they transfer blood to you, since they live, now what they will do, the person blood test, all the necessary tests that is required, they will do it before giving that person blood to you. Yes, President.
Oh, please wait 1 minute. Hello? We're in Liberia. Gary has sand in it. But before you eat a Gary, your horse finish with Gary now. You need Gary. If they come into the same plastic bag full of Gary to your horse, they will make sure that they're safeguard. They will safeguard the Gary, but when they see that sand too much inside, they can't send it to your horse because your children will eat it, the children will grab them. You get that blood, and that blood English are speaking to you. You understand this? So the people that will take your blood and carry the Gary. See, when I say inside your blood,
yes,
but it's a matter of what it comes from Africa anywhere, so don't they face it on the ground yet, saying inside. Yeah, in that blood.
yeah,
within my life being connected with anybody who use the camp.
like I said earlier, before you get typhoid, you might come in contact with an infected things like the toilet, food, water, and then you can also get it. You can also get it. You actually, if you can get it without coming in contact. No, I have not done a research like that. Maybe for Abel will come to clarify that. Yeah, Hannah.
Yeah, I noticed that typhoid patient, the blood can be black. So what can be the cause for the blood?
So how do you know that?
For several days, and they did my blood test. My blood was very black. And the next day, you have typhoid. Because the typhoid too much. That's why the blood black and black. And when she treated me, my blood color changed to red. And now no time.
Okay. So like you said, she did your test, right? So it was based on the test that she came up to tell you that you have typhoid. But I don't think it's because the blood was red or black. No, I have not come across research like that.
Yes.
Yeah, the last question. They're going to see. Second.
I said 3.
3 finish.
Okay. Alright, so Brother will come to talk on malaria.
Alright, thank you. There are some key things you need to know. The 5 contaminated F can lead to the spread of typhoid, food, fingers, flour, feces, and fluid. While 5F, when they get contaminated, you might not come in contact with someone who has typhoid, but there are flour that sat on the stool that got typhoid. Can't sat on your food and you eat it. You didn't get typhoid there. You might not come in contact with a flour that has typhoid, or probably someone who has typhoid will dish it up. When you use a Bible, you say, why I have already right? And they contaminated the food, you ate it. You didn't get the typhoid. You see, but most of us, if for example, I don't want to bring short bread, and I bought short bread, my body bank out to me, I use my finger, right, and cut that short bread. I give them the people, and what that short bread for eating it. No, eat it right away. So my finger will contaminate, that short bread will contaminate my finger, bank, eat it, get it out for. Are we there? So those are key things you need to know. That's why hand washing should be for everyone. How many of us can wash our hands before eating? After using the bathroom, wash fruit or vegetable before eating. But however, thanks to Amaran. So for malaria, basically in Liberia, malaria accounts for 43% of those admitted in hospital. So maybe working a clinic, you have 100 patients this week. Out of the 100, about 43% were admitted because of malaria infection. One in terms of OPD visit, that is people who come to the hospital, we treat them and go back home, right? Malaria accounts for 47% in Liberia. And those reports are given by WHO. So, malaria has a lot of causes, and at times people say mosquito is the one that can cause malaria. That's not true. One causes malaria is called falciparum, or say plasmodium. And the plasmodium got species. We got the falciparum, the ovale, the vivex, malaria, but all the ones are not important for you. It's important to us, put in nursing, right? But what you need to know is mosquito can transfer malaria from one person to another. Some people just a female mosquito. So the question, how do one distinguish female mosquito from male mosquito? They began to look right. So mosquito is the one that can transmit malaria. So in Liberia, the easiest way to know if somebody has malaria is to do that person body temperature. If the body temperature is greater than 37.5 degrees Celsius, we conclude that the person has malaria. Are we there? So anybody can buy thermometer you get at home. Once you do your chest temperature and it reads 37.5 or higher, they should inform the child has malaria. Now on the other side, if the person has a history of fever, my child then say, well, the last 2 days the fever hot. Then the child's chilling. This child is complaining of headache. The child has diarrhea, vomiting, body pains, weakness, or the child quick to get tired. The hand should go on malaria. Are we there? So that's the definition of malaria. So the average population for malaria are those children who are on 5 years of age. It means these are people who to kind of malaria, children who are less than 5 years of age. 2 is pregnant women. Because as a woman gets pregnant, there is a change in the hormone. There is also a change in the immune response. So she has risk of coming down with malaria. And also, people from countries where they don't have malaria, coming to a country where malaria is common, they are also a risk population. For example, if we do everyone a malaria test, if we use the rapid test, because it pick up one of the species or one of the things that can cause malaria, which is the key falciparum, it may read negative for majority of us. But if we do a malaria microscopy, we take a blood, put on a microscope. Majority will be either 1 or 2 plus malaria. But we say moving strong right, eating from bottle, walking, etc. But if somebody came from the States where malaria is not common, and they just have 1 plus malaria, that person will be badly treated compared to you and I that living here, or we have 2 or 3 plus malaria. So that's why travelers from countries where malaria is not common to countries where malaria is common becomes a risk population. So let's understand. Children below 5 years, pregnant women, and what? and travel right? They are the raised population. So if a child has malaria, how do you know? One, there will be fever, a child's will be hot. Two, there will be no appetite. Three, there will be weakness. In some children, they may convulse. If you do the child blood glucose test, the blood glucose level will drop, it will be low. Now, in the case of pregnant women, they will frequently experience low blood, we call it anemia. As they take folic acid, the blood increases. When they stop, it drops. Now, for the treatment of malaria, yes, we have treatment for malaria, which means if you are diagnosed with malaria and we treat you with those medications, when we repeat a test 14 days later, it's going to be negative. But let me say this: if, for example, I was diagnosed with malaria last week on Monday, and I was treated, for the day I end my treatment, up to 14 days, when my malaria test is repeated, will be positive. But that positive will call it a false positive result. You know what it means? It means that even though you have taken treatment, the malaria parasite is still in circulation, but it's not strong to cause infection in you. But because your body took time to synthesize it in circulation, the body will take time to get it out of the system. So don't say, oh, I took malaria medicine, that's why we are doing malaria test, it's still positive. Yeah, it is positive because malaria parasite is still in circulation. It takes up to 2 weeks or 14 days to be completely out of circulation.